Success depends upon values. It has nothing to do with technical knowledge. So values of being honest, integral, keep on learning, continuous improvements. When I am taking a decision in terms of somebody growing in the organization, my view is behavior comes more important than his technical other capability. And if you are honest with your work, if you are dedicated, you're not doing anything wrong, you will grow one day. If you have to take a manufacturing vessel with clean in place and sterilization place, we used to go to Europe.
Right.
And nobody used to give that kind of specific controls. Now we have everything available in India. You don't need to go out of India.
Yeah.
I remember at around 12:30, my that boss came and she said, "Why are you sitting? Why are you not working?" I said, "I have completed." She said, "Have you completed environmental monitoring?" So I said, "Yeah, I have completed that." Water sampling? Yes. Have you done this testing? I said, "Yes, I have done." She said, "But 12:30? Those three girls were doing it." Generally on Sundays, one movie is for sure.
Yeah.
And I like all movies which are like where you have to put your brain aside and watch. South Indian movies, wo hawa mein ud rahe hain.
But I also heard that you don't take phones after 10. Is that true?
Actually, after 9.
After 9? Oh, okay, I need to correct this. What if you find a people in your team or person in your team who is not having the right intent, or maybe...
So if a person who is not having the right intent, I'm not talking about the performance. If the person is decreasing the quality culture at the site,
What do you do? Hello everyone. On today's podcast series of Microbiology Matter, we have none other than Mr. Vikram Shukla, a president for Zydus Lifesciences. So his stellar personality is, of course, very impressive, and in microbiology world, his name is recognized as a very in a very respectful way. So let's listen from Mr. Vikram Shukla about his journey, about his leadership lessons, and how he came to this level, right? So Vikramji, welcome to the show.
thank you.
It's really an honor to have you here, and I'm really getting an opportunity to talk to a leader like you.
It's my pleasure, actually.
Great. So Vikram, I think let's start with your journey, right? Today you are handling a position as a president, right? And I'm sure for a pharma company, holding this position is so like it has so much of responsibilities, and in a pharma world, in a sterile environment, I can certainly understand the importance of this. So how your journey has been, how you started this journey? Have you dream about this, like you will become someday handling a very reputed company ka presidentship?
Absolutely not. If I have to, I mean, on a lighter side, I remember when I started my journey, so I started with Nicholas Piramal.
Okay.
And immediately after a year, I got married. So I was speaking to my wife one day, and that time my father was retiring from, he was a government doctor. So he was retiring, and during that, so he had taken his first car, a Maruti car, when he retired. So obviously,
which car? Alto?
Maruti 800.
800, yeah,
So-
that's certainly.
So he was retiring at that time, and I took the car. And I said, my dream is that I have to take Maruti 800 before I retire.
Wow, that's so amazing.
So that was obviously
I can
no
understand
way
this.
I had thought that this will be the situation. Obviously, at that time,
I can relate this a lot, because same case happened with me. I bought my first car, Maruti Alto, on my father's retirement.
Oh, okay.
That's great, amazing, sir.
So obviously, I never dreamt of it. Obviously, I started as a microbiologist in a microbiology department, doing all the environmental monitoring, taking sampling. And during that time, I don't know whether I'm sure you must be aware. So now we get pre-prepared plates.
Yeah.
We get everything, disposables, everything. So at that time, we used to actually the glass plates used to come. So all the test tubes for endotoxin was reusable with glass. So the washing. So so when I was in Nicholas Pyramid, and then after 1 year I had joined Lupin. In all those, the responsibility of cleaning and making sure that you sterilize was with the microbiologist.
Correct.
So we actually cleaned, the entire washing was done by us. So no contract person to do the cleaning. What people have now, area cleaning. So in grade B, when we used to go for sterility testing, the cleaning of those areas, including sweeping, everything was the microbiologist's responsibility. So all that we have done. So it was, we never dreamt. We thought that maybe someday at the time of retirement we'll be somewhere manager. So my journey was like, I started in microbiology. I moved from microbiology, and I was very clear that obviously I have to keep on learning, and that's I still do. So I went into IPQA, and then slowly I moved into validation, where I felt that I learned a lot when I moved into validation. So from validation, then I moved into quality assurance. From quality assurance, then finally I started taking care of chemistry as well. So chemistry lab. Then I became head of quality. From a head of quality, after maybe 5-6 years as heading the quality at various, including corporate quality, then I decided now it's too much. I think, and that was a very specific reason why I wanted to move into operation. And the reason for that was that I felt that being on this side, I'm not able to contribute to quality as much as I can do when I moved into operation.
Really?
Because I can actually do all the improvements which I feel will be important
as operation,
which is required for the product quality.
Correct.
Specifically from sterility assurance perspective. And that's what I did. The management was very supportive, I'll say that, and I really respect them that they said that from head of quality, you moved into taking care of site.
It's an unusual transition.
Yeah, it's slightly, now it is becoming slightly common, but earlier it was, at that time, this was in 2013. 2013, this was not very usual. So it was unusual at that time. So I took that role, and obviously it was really enriching. So, and from there, taking care of multiple injectable sites to becoming a global, in Pfizer, I was taking care of Asia Pacific region for all their injectable sites. And now back to Zydus. So Zydus was the company which allowed me to move into
Oh, really? Wow.
from quality to operations. So it's
today
a wonderful
you are holding operation
and quality.
Operation and quality both now.
Both.
Okay, circle
for
is completed.
Injectables. Yes. And I love this job because I'm very, very clear that means you have to balance operations and quality.
I agree.
And if you have the experience of both, that actually helps to be very, and so it helps in the decision making. And I'm very sure our head of quality, who is taking care of injectable quality and operations, both will not be unhappy that he takes care of, means he takes one side or another side, very clear about the science of decision.
I think you have seen each and every aspect of quality also and microbiology. Correct. Right from sweeping the floors to everything.
Yeah, exactly.
I think it's I don't know, was it a strategic or was it like a
no,
destiny was making you doing that?
It was absolutely not strategic. Strategically, I took only 1 or 2 decisions in my entire career. Otherwise, it all happened on its own.
This is a fun to know, right? I do interview with so many leaders. In 90% cases, leaders talk like this. They always say, and they are very open to say that case is accidental.
Correct.
Or it's like a destiny. The journey, I just keep taking those decisions.
Correct.
And journey made it to
see my view is that it's not about technical knowledge. I can tell you that in my plants or my portfolio, whatever I'm handling, in there are hundreds of people who have more knowledge than me. So what I feel is that the success depends upon values. It has nothing to do with technical knowledge. So values of being honest, integral, keep on learning, continuous improvement. So these kind of are very, very important. And specifically in this, and if you ask me also, I've seen that when I'm taking a decision in terms of somebody growing in the organization, my view is behavior comes more important than his technical and other capabilities. And another thing which I've seen is that if you are honest with your work, if you are dedicated, you're not doing anything wrong, you will grow one day. वो एक है ना मूवी आई रिमेम्बर देयर इज अ मूवी वो नहीं शाहरुख खान की मूवी थी आई फॉरगॉट द नेम उसमें ऐसा था कि जब आप कुछ अच्छा करते हो तो पूरी कायनात जुड़ जाती है आपको
ओम शांति
ओम शांति
Great.
So I
get
believe
to know
in
that you are a movie person. I'm going to come back to that. Wow, well said, sir. Well said. So values are so important. And
values are very, very
I agree. The behavior, attitude,
Correct.
what we talk towards our work is so
Absolutely.
important than our technology
Correct.
knowledge. That's really great. So, yeah, we jump to your career, but Vikram, first as a microbiologist, I really wanted to understand, like for my audience, what is microbiology all about and why it is important. Sorry, it is a very basic question. I know I am asking this to president. I know that.
But so I'll answer like a president only. See, if you see the future of pharma industry, correct? So there is a shift which is happening, and you can see that the entire shift of products which we were earlier taking is moving towards injectable.
Yeah.
Biologics, you can say. So everyone is moving towards that. So microbiology, okay. So injectable is becoming more and more important.
Yes, very true.
And in injectable, the only thing which is impacting most of the companies currently is microbiology. Correct? Yes. It's not about microbiology department.
Yeah.
It's about the microbiology, microorganisms entering into your product and which can contribute, which you can't detect.
I heard 70% of 483 came through for microbiology.
Absolutely, absolutely, and that's the reason why microbiology is very, very important. See, the basic understanding of microbiology for all the people, whether it's an operator or whether it's a president, they should have the understanding of microbiology because the decisions are made considering that if you do this, if you touch that. There was just recently, I was in the session, there was somebody was asking like, there is an intervention which is done in the aseptic part, how do you handle that? I said, why you are doing intervention? You tell me. He said, no, it's not available. I said, make the availability to make it intervention free. Correct. That's the only way. So otherwise you will not understand. You will say, oh, I sprayed, I did the disinfection. So these are not the way. So the understanding of microbiology is very, very important for anyone. And microbiology is difficult. So whatever you can see, you can act. Whatever you can't see, how you are going to act. So it's all about assumption, the knowledge, the risk assessment, the contamination control strategy. So everything you have to take into consideration before you take a decision. So it's a tricky, I will say, it's an art. It's an art where you have to go into the depth of microbiology to really ensure that the products which you are manufacturing are sterile.
Okay. I'm going to ask this question. I know if you look at India, we all are called India as a pharmacy of world now. As a media company and as a pharma person.
And that's true as
yeah,
well.
That's true.
Correct.
But we have more towards generic, and of course that has a good part as well. Like we are making drugs more affordable. And a larger population is getting benefited out of it. But in injectable side, where are we?
See, again, I'll say it's the lack of knowledge. The lack of knowledge that, means in India, I'll say that we are fantastic in oral solids. Nobody can beat us.
I agree.
Across the world, nobody can beat us. In injection, what's happened is that the leadership knowledge, I'll not say the people knowledge, the leadership knowledge on injectables and microbiology needs to be improved for them to take the right decisions. we still are in the situation where, say for example, if you have to improve, and if you have to put a capital, the first question will be, what is the ROI? In microbiology, you can't give a ROI.
Correct.
It's difficult, and everything cannot be justified. But if you feel that this is going to help us in the quality of the product and making sure that you are increasing the sterility assurance level, that's going to benefit. Now we cannot quantify that, but we can just say that it's going to help. That's it. So I would say because of that reason, India has lagged previously. But because of all the previous inspections which has happened in India, and the FDA is very critical about our injectable facilities, there's a huge change. And that change is very, very welcoming and very, very good, I'll say. It's a fantastic change which we are seeing, where people are investing because they know that this is going to help us. Not from inspection point of view. If we are addressing the inspection observation, I think we are wrong. We have to understand the science, and we have to address the quality of the product. So we address, what I've seen is that once we get a warning letter or a 483, we act on that as best as possible.
Correct.
We leave other things which can impact the quality of product, and we wait the inspector to come next time, and then he'll impact us.
Correct.
So those kind of things. But I mean, I have seen a big change in the last 10 years in Indian pharma industry, and I am very confident that in the next 5-10 years, we'll be very, very good. And most of the companies, see, currently, if you ask me, there will be very few companies who are multinational who will be ready to transfer their technology and get a biologic product manufacturer in India.
That's true.
But that's going to change in the next 10 years.
Okay.
So we are currently going westwards, and I am very sure will come the companies, they'll come here to reduce the cost. Okay. And because by that time we will be putting our names that we can manufacture very good injectable products.
But what do you think? Does cost should be the parameter, or our science should be the parameter?
See, it's absolutely very clear. It's about the quality and quality comes based on science.
Correct.
If you don't understand the science of what you are doing, you'll never get the quality. So quality is key. And see, there are multiple ways of getting to the quality. If you understand the science properly, your cost will not increase. People feel that if you have to improve the quality, you have to increase, you have to reduce your productivity, and you have to increase the cost. Absolutely wrong.
Oh.
The more you focus on quality, the less will be the problem, and the more will be the productivity. And I have given this example multiple times with multiple companies where I have worked, with a proof that just focusing on some of the critical quality parameters, we were able to improve the productivity by 20-30%.
Really?
Correct. It's and without impacting, I'll say, just focusing on quality.
Wow. Okay. But that's is a very big misconception. What
Absolutely.
I have always seen.
Absolutely.
When people are focusing on quality, you need to invest a lot of time and cost.
Absolutely. Another thing is, and there was one person, he used to, he has a very good saying, I forgot the saying, but the purpose was that pharma industry, he was not from pharma industry. What he said is that in pharma industry, we are very good in creating a system around a problem. Say for example,
I heard this thing.
So we will create a deviation, and we will create a fantastic system to address the deviation. Not addressing why the problem is there. And in injection, I'll tell you, so the current major concern is about the interventions which happens in the aseptic environment. Whether entry of a person, entry of a gloved hand, or entry of a person during setup. These are the contamination points. Now, if you avoid that by maintaining your machines properly, if you avoid the alarms in the machine, so you don't have any risk, correct? And just imagine, so if I am running a machine for 24 hours where no human intervention, the productivity automatically will be very high.
Hmm.
So it's about focusing on the right parameters,
Hmm.
which improves the quality,
Hmm.
and as a byproduct, you get productivity.
Correct. So, like just for my understanding, does robotic processes or automation will help us to improve our processes in this area?
Absolutely. But it's a story of why you need robotic.
Mm-hmm.
The reason why I'm saying is that the current machines which are there,
Okay.
say, let's take some key European manufacturers who are there, who are supplying filling machines or
Correct.
PFS machines,
Correct.
cartridge machines. They have been designed to run without the operator. So you set up the machine, you switch on,
Okay.
and it will continue to fill. It has every
So
controls
those are
in
robotic
place.
processes only.
So it's not robotic.
Oh, okay.
Robotic is one step further,
Yeah,
where
okay.
everything is. So
Okay.
these are very simple machines.
Ah.
The only problem is we don't maintain it.
Hmm.
We feel so maintenance is a bigger concern in our industry, where we consider that as a checklist of preventive maintenance, that this is right, this is right, this is right. We don't maintain the machine, and that's why you see a lot of breakages, intervention. This got stuck, vial got broken, vial fallen. So all these kind of challenges which are there, where you intervene with the machine. And once you intervene, obviously there is a risk of sterility.
So it's an engineering challenge, kind
It's
of.
an engineering challenge. And that's why if you convert that into quality, that let's focus on how I can reduce these kind of challenges, the productivity automatically increases.
Correct, correct. So, what you are saying about, like, when we talk about this engineering, I have seen most of the technologies are from Europe, majorly Germany, Italy, Swiss. So that area is like predominantly
Europe.
dominating the whole industry. And I saw the commercial part also. Those are bomb.
Huge.
Yeah. So, what's your take? Like, why Indian manufacturers are, like, you must have, because as a customer side, you must have had this question, ki, why Indian manufacturers cannot have such kind of engineering marvels?
I'll not say that they cannot and they are not.
Okay.
Correct. So let's take an example. So earlier I remember when maybe 15, 20 years back, if we have to take a manufacturing vessel with clean in place and sterilization place, we used to go to Europe.
Right.
And nobody used to give that kind of specific controls. Now we have everything available in India. You don't need to go out of India.
Yeah.
Now, if you see packaging machines,
Correct.
you have world-class packing machines which are manufactured in India.
Rather in Gujarat.
Yeah, exactly. Then, if you see some of the filling machines which are getting, and again in Gujarat, some really very good companies. Now, the only thing which I feel is the difference is that if they put the similar controls which are there in the European machine, their machine will not be as what you can say cost-wise, it will not be comparable. Comparable means they will be far less than European company,
Correct.
but they will be at 50%, 60% of the European company. So what these manufacturers, they are saying is that if we have to pay, then we will go to Europe. So if we have to give, the second improvement area, what I'll say is for our manufacturers who are in India, is the software parts, the controls.
Okay.
I think otherwise, see, we are making fighter jets now. We are making a machine.
We are making Chandrayaan.
We are making Chandrayaan. So India can do anything. It's only about.
But, like, I also heard, like, Indian filling machines or like these engineering machines, whatever we have, most of the times they ignore a part of compliances. Like, I heard about, of course, I wanted to get clarity from you.
No, it's
where,
not like that.
If you do smoke testing, sometimes your compliances are not getting clear.
So let's understand. So the infrastructure which has been created by European countries, that infrastructure, not to do machining, the other part, that what should be types of controls which you have. You need the people who are from pharma. You need the people who are from. So that once that's done, I am very, very confident that our manufacturers will be able to get. I mean, they should take people who have actually worked on compliance. and they should take the
And they
understanding from them.
They can only do it when they will start working with the pharma industry very
Correct.
closely.
The price will increase, but
Yeah.
see, currently what's happening is that, oh, I have to sell these products in domestic, so let's take a domestic machine, and I'll get it in this price. So if they increase with the same type of compliance and same kind of controls which are there, obviously the cost will be high.
But do you
That's a concern.
But do you really agree with this kind of differentiation where if you wanted to sell the machine like medicine domestically, you have a different setup, and if you wanted to do it US export,
I'll not say anything about the quality. See, quality, I'm very sure, except those companies, see, all big companies who are there in India, correct? I can tell you that they focus on. I'm in Zydus, and we are very clear about whether we supply in domestic or whether we supply in US. The quality has to be same. It's only about that the regulatory hurdles are lesser when we are supplying in India.
Yeah.
So that's why.
Indian CDSCO, we should be also raising our bar to EMA or MHRA.
I'll say yes, they should. I am not saying that they are not. Correct. It's all about the inspectors. I think the guidance, whether it's Schedule M, so they have put up a fantastic guideline.
Yeah,
and
yeah.
if you are complying to that, I think you will comply to any regulatory requirement.
So we are moving towards.
We are moving 100%. We are moving towards it, and I'm very, very confident that in the next 5 to 10 years, Indian injectable vertical also will be very good.
I'm certainly we should look forward to it because the Indian population, what we have, I think we should really care about them, and
Absolutely.
I really feel our government is doing all great
correct.
efforts to match that quality. It will take some time.
It will take time.
We are like in a size, we are 150 crore.
Correct,
so it's not that easy basically to quickly change things.
Absolutely.
So I certainly agree with that. But now, at that personal note, I really wanted to know from your side, being a president of the Zydus kind of company, a very reputed company, and I'm sure you guys are very high at standards. Are you happy with what you have, and what degree of improvement you wanted to bring in Zydus?
So, see, first of all, obviously, I joined this organization now 11 months back, and I'm very happy with the role which is there. See, the challenges in the role actually keeps you busy. The more challenges, the more busy you are, and more enjoyment it is. If the things are moving as expected, everything is. You don't have any delivery challenges, you don't have any regulatory challenges, you don't have any quality challenges, then life is simple and you'll get bored. You'll get bored.
Yeah,
so the learning happens when you have challenges, when you have regulatory challenges.
Yeah.
And that's why I'll say that I'm really enjoying my role. Obviously, not because I'm in Zydus, but we have a full liberty of taking any decisions. That's the best part of it.
That's good.
Since I have joined, I don't know how many capital expenditure requests I have sent without any budget being there, and everything got approved. So
you're on the record.
So from those perspective, I'll say that authority is there, challenges are there, people are good, and they're ready to adapt to the changes which are happening. That's all what you need.
That's really great. Now let's move back to your personal.
Okay.
Too much of technical, right? So now I wanted to know about how your day looks like as a president of Zydus.
Oh, very relaxing.
Oh, really? This will be taken as a different way by your whole
No,
team.
I'm very, very clear. See, I believe in believing in giving authorities to other. I believing in no micromanagement. I believe that we have to trust people to take decisions, and if they fail, I am accountable. But we have to allow them to take decision, allow them to fail. So I don't poke into everything which is happening.
Correct.
That's number one. Any problem which is there, I am there for them. So my day is, and I'm not joking, is quite relaxed. I'll just ensure that all the things, I mean, obviously I have some routine activities to complete, some gambas, some this, that.
What time
But
you start? What time you start?
yes, my time is fixed. 8:45 I'll be in office.
8:45.
And another thing which I keep on telling my team, office time is 9 to 6, 6:1 I'll leave office. I'm very, very clear about it.
Okay.
It's not about that I'll leave a job. I'll make sure that I complete. I don't take lunch. I don't take anything. I'll make sure my work
So
is
you put
completed
everything in
during that
9 to 6.
time. But very, very clear, I don't stay back. If I stay back, my entire team stays back, which I don't like.
I also heard that you don't take phones after 10. Is that true?
Actually, after 9.
After 9? Oh, okay, I need to correct this.
But I get up very early. I'm awake
you are
at
5
8.
a.m. club?
No. I'm 3:34.
Don't tell me, really?
So today morning I sent you the presentation at 4 a.m.
Actually I slept at 4, so that's true.
So I'm a very early riser, but so
Brahma
obviously Brahma
You follow
Muhurt
Brahma Muhurt.
and you are fresh at that time, absolutely. So you
Tell me
if
more
you-
about it.
So all good ideas which has come till
Yeah.
to me till now in terms of what I should do, what improvement, what are the current challenges, and it has come during that time only.
So 3:45 you wake up.
So around 4, you
Around
can say,
4 you wake
between 3:45 to
So
4:15.
what do you do after waking
Nothing.
4?
Nothing.
Art of doing nothing.
So if
That time you
if
do
I
actually
plan
most.
something at that time, I'll not be, you can say, my innovation will go away. If I
Okay.
plan something,
So you
then
do some
my
meditation
mind,
or something?
nothing. So so after some time, my wife will, I'll wake her up with a coffee, and I'll say that
Really?
then we just
She will also
chat.
wake up at 5?
Maybe
she happy about it?
4:45. Yeah, she's happy.
Really? I should ask her.
So that's it. And see, I don't know whether you are aware. So I have a very interesting journey.
Okay.
In the last 19 years, I went into the company which was under a regulatory scrutiny. Warning letter, critical observation from MHRA. All my 4 last companies were under warning letter. So,
And
and
still
I
you
took,
leave office at 6.
yeah, I took that challenge that, yeah, even, I mean, we had some challenges and regulatory challenges in my current role also. But I'm very clear that I'll leave at 6 without leaving. Obviously, if there is a work, something, if regulators are there, audit is going on, obviously I'll stay. But making sure that everyone has to, so work-life balance is very, very important for the health of the people, the mindset of the people, and everything, the culture of the
But
organization
it
and
was
quality
like
culture
a
is.
president talking, or it was like when you started your career, that time also you were like,
No, I was like that only. I'll make sure that I try leaving. So, this is a very interesting story. Actually, what happened that when my first job, so there was a leader, and she was she didn't want a boy to be in microbiology department. So I was kept outside, and because the site head had taken my interview and he has appointed me. So she was not very happy. This is very interesting. So so all the microbiology work were done by 3 females, and she was the leader. So 4 females working in the microbiology department, and I was given. So there was one anti-acid which we were manufacturing, and there is a aluminum and magnesium. Was supposed to be sampled. That was a very tedious job. So that was the only job I did for 6 months. By chance, what happened that it was decided that so one left, one got married, and the third one had jaundice.
okay,
During that time. So
okay,
there was no other option for the
allowing
boss
you inside, yeah.
to allow me inside. And I remember, so we had to do plate exposure, we have to do water sampling, we have to do water testing, and prepare. Water testing means pour plate method and
Correct,
all
yeah.
that. So 3 girls were doing till 5 p.m. I remember at around 12:30, my that boss came and she said, "Why are you sitting? Why you're not working?" I said, "I have completed." She said, have you completed environmental monitoring?" That time, the environmental monitoring plate exposure used to be 1 hour. So I said, "Yeah, I have completed that." What was happening? Yes. "Have you done this testing?" I said, "Yes, I have done." She said, "But 12:30, those 3 girls were doing it for the
Till
entire
5 p.m. every day.
So I'm to be very frank, I'm very fast in my decisions and very fast in my activity. So I try to
I
complete my
experienced that.
so I try to complete everything within that time,
Correct.
preferably.
Wow. That's a wonderful
My
story. Right?
my meetings also, none of my meeting will extend more than half an hour. I'll make sure standing
How you
meetings.
do it?
That's it. First, come up with a problem. We'll do it. No going, okay. Sometimes it happens that we keep on discussing the same thing again and again. Very clear what decision you require. This is the decision. Go ahead. Risk hai. See, any decision delayed is decision denied. That's very clear. Correct. So if you are delaying it, that means things are not happening. Take a decision. What the worst case is that you will be wrong in that. Okay, we take the accountability. So for being wrong, but I take the decision. I don't take any time in taking any decision.
But tell me more about the meetings. It's very interesting because I know there are memes going on like always because we don't work, we do meetings. Right.
So,
but how you manage like every meeting half an hour? How you do it?
So see, first agenda has to be clear. What decisions are required? Because if something is getting escalated, that means there is some problem. Correct? Things are not moving, or there is something. So you let me know. We'll come back. We'll take a decision. We'll call the right people and take the decision. Actually, good part in Zydus is that our meetings are comparatively smaller. Comparatively, means even before I joined, it was smaller only. But in my previous organization, multinational, correct? So their meetings, so there I moved into standing meeting. Nobody will sit in the meeting. So everyone will do standing meeting, and standing meeting automatically gets over in half an hour. So the
We
best
called
part,
as stand-ups only.
stand-ups only, correct. So anything you require, give a clear, and then there will be some people who will start discussing something else. So somebody has to be a decision maker. No discussion. We have to be on the topic only, and then take the decision.
So much to learn about this because doing meetings and effective meetings is art.
Absolutely.
And
absolutely.
most of like rather frankly at my level also I have seen many of my meetings gets longer.
Longer. Correct.
So I always struggle to contain the meeting. So it's very interesting to learn more about it. So so let's move towards your day. Like what are the most challenging times you face as a president or as a leadership? And the next quick question is, how many people report to you? Around?
So 7.
7, but the whole team would be much bigger.
It was more than 1,000.
More than 1,000. You're saying it like okay.
But see, I'll tell you. So there is, see, if you take any challenge, it's part of our role. I don't get tensed because of anything which is happening. So even during the audit, I'll be very relaxed because see, we know the process. If there is a problem which has happened, we need to act on that. We have to address. Now we have made a mistake. Obviously, the observation is because we have made a mistake. So why crib about it? Why to question the people who have made a mistake? It's our responsibility. Yeah, accept the mistake. We have to address. Correct. And we have to address this it holistically by going into the root cause and addressing that, rather than cribbing, telling people you have
lose
not
your
done.
cool?
I think you have to ask this to the team. At least they have
what
told
is your
me.
perspective? Your team is here. I know that. I will ask them.
No, so at least everyone in my entire career, everyone has said we have never seen you losing your cool.
Really? How you do that?
I don't know. It's just about accepting that, and see, we have to accept others' perspective also. When somebody is coming and they're trying to understand, and see, this is as a leader, if you have to uh, be a good leader, you have to listen. Correct? Once you listen, you try to analyze from their perspective, and once you analyze from their perspective, then only you will be able to take the right decision. So why to lose a cool? I mean, everyone, see, nobody comes to a facility to manufacture a product by doing a mistake. So everyone comes with the intent that I have to give my best.
But
today.
what if you find a people in your team, or person in your team who is not having right intent, or maybe
No,
not?
no. So it's okay. So if a person who is not having the right intent, I'm not talking about the performance. Performance can be
That is okay.
different.
Intent is
So I always see from quality culture perspective. If the person is decreasing the quality culture at the site, that I am very, very clear.
what you do.
That person will not be there in the organization.
But
That's
then
very
you
clear.
lose your cool, or
No,
you
it's-
directly send a.
No, it's not
letter.
about cool. I'll make sure that you're not fit for this. And I'm very clear in my communication as well. Giving feedback, I'm very, very clear. Whoever it is, I give a very straight feedback. You're not suitable for this role. So we have option. We'll transfer you somewhere else. Or you can look for a job. It's from that perspective.
How many
but
people you
without,
have fired yet?
Many.
Many. And
Many in my...
Tell me the most difficult fire. Most difficult.
So that was
person to
very
fire.
interesting actually. So I'll not obviously not share
okay,
the
that's
name.
fine.
But this was a person who had some political connection, and he was actually creating a very big problem at the site.
Yeah.
And political connection means he was actually involved in political
active
rallies
politics.
and active
Okay.
politics. So they had taken a decision. So when I got all the information, I realized that it's not so. Integrity perspective, integrity, financial integrity, data integrity, all was a concern. And I said, no, I have to take a decision. So obviously at that time I had to call the compliance. The compliance team was in US. They said, we don't have a proof. And unless you have a proof, you can. I said, I take on me, but I cannot allow somebody to be within the organization and deteriorating the quality culture, which I can't accept. So then they said, then it's your risk. I said, yeah, absolutely, go ahead. So I called that with a security. I said, done. You will not go to your room also. From here, you'll go straight out. So they said, okay. But the HR person actually got worried. So the decision was taken, he was sent out. So he got worried. For 1 month, I was provided police protection. One police van used to go with me to my house and used to come.
Oh my goodness, really?
And nothing happened. But see, from this perspective, I'm very, very clear. And culture is very important. If the culture is not set right, and if people feel that chalta hai, that's not true.
Wow, that's amazing leadership lesson. It's really great, and it's an amazing incident also.
No, see, I'll tell you. See, people get demotivated if they feel not because I am not getting promoted. They get motivated if they feel that
Wrong
the
person.
wrong person is promoted.
Yeah.
And the second one is that the wrong person, somebody is not working and the management is not doing any action. The demotivation becomes very, very high. So we have to take some actions.
Sure. Perfect. A lot of serious talks. Let's now talk about your movies.
Okay.
I heard your movie first.
Yeah, I'm a movie. I mean,
me your favorite
anytime, whenever I get free time, specifically
So
on
after
Sundays.
9? After 9?
No.
No?
After 9, I sleep. 9:30, I'm on the bed.
Yeah. You stay in Ahmedabad, right?
Yeah, I stay in Indore.
But Ahmedabad has that pretty good culture where they get to bed by 10:30 or something.
No.
No?
Ahmedabad, you will see people at 12, 1, 2 also eating ice cream. So, absolutely not. So, generally on Sundays, one movie is for sure.
Yeah.
And I like all movies which are like where you have to put your brain aside and watch South Indian movies. वो हवा में उड़ रहे हैं. Those kind
That's what I was telling you. My cousin called it as anti-gravity movie.
anti-gravity.
You really like.
So I
There
really
is
love
no
those
sense
movies.
of gravity and science. You kick someone, that person will go to the building top or something.
So ये serious movies I don't like.
Which is your favorite?
ऐसे है ना बहुत सारी movies हैं.
अभी immediately कौन सा नाम आ रहा है?
Immediately I'll say Three Idiots.
Ah, really?
It was very interesting. बहुत सारी. Yesterday for some time my kids were watching and I was seeing वो Dilwale, Shah Rukh Khan and Varun
my
Dhawan.
God,
That
okay.
was also very good. And just keep your brain aside. थोड़ा मस्ती भी चल रहा है, action भी है. It's good.
But on Sunday, whose choice of movie you watch?
So obviously one movie is of my choice. और बाकी तो my kids are like English movies और वो सब I can't
वो
see.
series वगैरह है.
Series also. So I can't see those.
Okay.
My wife likes वो English rom-coms.
Really?
I like South Indian. So sometimes I have to see
So you have multiple
English
series that you are
rom-com. No. So
No?
सबके time fix है. When I'm seeing movie, तो I'll see my South Indian
So
movies.
anyone joins you to watch those movies? Or no, you are watching.
Sometimes my wife joins, but बाकी बच्चे तो जैसे if they see South Indian movie चालू है उठ के चले जाते.
They are missing the fun. So have you watched Bahubali?
Obviously.
How many
I saw the epic also.
Oh really? My
In
goodness.
theaters.
No one can believe a president of a company. We always feel that it's so
बहुत
tight
serious
job,
होंगे,
serious
sir.
job. And you are watching movies all the day. That's really wonderful. But I think it's all about your discipline and your leadership mantra, which makes you to spend time on your own hobbies as well. So that's really great to know. So I think we can talk like anything, but we need to look at the time as well. So let me now get a leadership mantra from you. What's that one message as a leader? You've been a person from ground zero and to now you at the position of leadership.
Interesting. So I'll put it like this: that for leaders, see, I believe in. So there are two approaches. Top-down approach or bottom-up approach.
Yeah.
So I believe in bottom-up approach. Okay. I feel that we should allow people to tell their problem and we address it. Obviously, the direction, the future of what we are going with the company, obviously that depends on the leader. But the challenges which they have, the people are, say, if we do preventive maintenance of the machine to ensure that the machine is running, the entire plants are being run by the people. And if we don't do preventive maintenance, and the preventive maintenance is making sure that they are happy, the culture is there, they are being listened, they are being given the right infrastructure, the transportation, the canteens, listening to them, open environment where they can speak their mind, they can come anytime to my room to share that I have a concern. So all that, if we create a culture, I think that's what my leadership mantra is, that I have to listen to the people, act accordingly, obviously put some of my thoughts and address it.
That's very beautiful, like preventive maintenance of human. Great. I think Vikramji, it was a really amazing discussion and insights. I'm sure my audience will love to listen to this podcast.
Thank you.
So once again, thanks a lot for sparing your time and sharing so amazing insights of your life.
Thank you.
So once again, thanks a lot.
Thanks a lot.